Let's talk about shin pain. So the shin is the muscle running on the front of your lower leg, and it's also known as the race walker's muscle. It's the main muscle where people are getting injuries when you are, starting off in race walking, and between 10,000 to 20,000 kilometers, it's the number one area where you will get injured. This is because we have the foot, and the race walking motion is we lift the foot upwards so we can heel strike, and that motion is the main motion why we will have and develop the shin muscle. But it also obviously comes with problems. What is good about the shin muscle is it's really easy to target, and it's very easy to strengthen. It's very easy to do self-treatment, but it's very important to understand and know that if you haven't done any strengthening, it can get really sore. The same applies with if you are doing self-treatment. It can get very sore from the massage or the treatment itself. So if you have never touched the shin muscle, I would advise you to maybe go a little bit easy at first, and then you can work your way into the muscle. Because if you would go at it really hard, you might not be able to actually use the foot the same day or the day after, because it will be really, really sore. So unless you're used to actually treating it, I would start off easy, and then another 2 days you go again, another 2 days, and so on and so forth. And then when you've given it maybe 2 weeks, you can really dig into the muscle and work on those problem areas where you feel it's tighter. Basically, what I use to strengthen the shin is either a normal kettlebell. At the moment, I'm using a 12 kilo kettlebell. It's quite a heavy weight, but when you start off, you can start off with whatever you feel, 4 kilo, 6 kilo. If you don't have access to a kettlebell, which I would recommend as the first choice, you can just have a normal barbell, handlebell. So what I do is I place the kettlebell on the edge of the bench, and then I just wrap this band around the handle. It works really good with a towel or a t-shirt or whatever you have, so you get a little bit protection for the foot. And then you just start doing your reps. And since it's only a kettlebell, you need to stabilize the foot in all directions, so it's really, really effective. And as you can see, the shin gets a really good workout. Normally when I do this strengthening, I'm doing 3 sets of 10 repetitions. So I do 10, and then I switch foot, and I go with the next foot. It's quite straightforward. It's very easy, but the result is really, really good. So this is like my main exercise to actually strengthen the shin muscle. Now, if you don't have the kettlebell, like I said, you can use the handle. It's the same principle. So I put it on the edge of the bench. I use my band to get a little bit of protection for the foot, and then I need to lift the weight out over the edge. But once you have the position, you start working your repetitions. It is a very, very effective exercise for the shin muscle. And you can see my shins are really working. When it comes to treating the muscle, I have a normal silicone cup. My favorite tool is probably the Graston tool, so it's just a metal bar. and obviously normal manual therapy with the hands. In the top of the shin is normally where you would find a really nice pressure point. So in the middle of the shin, when you use your fingers, you can actually feel where kind of the tendon go inside here. And if you would just push down on that part, when you feel, okay, this is the middle, you would start feeling mostly radiation down into your foot. When you feel that, just hold it for maybe 30 to 60 seconds until you feel the pain is disappearing, and then you can just move on to the next spot. So this I would go through the whole shin muscle and look for those spots where it's really tight, and then just keep the pressure up. It's also really effective obviously to just massage the area. Now, when I want to go a little bit deeper, this is where the Graston comes in. So especially in this area above the ankle, it can get really sore. So obviously a Graston is a scraping tool. So I would use the Graston to just scrape in an upward motion. And this can get really painful. So if you're not used to it, it can be very painful. Obviously, I would always use oil or massage cream or something to protect the skin and also for it to glide. I'm not gonna use that now today when I just demonstrate a little bit, but I would always use some kind of massage cream. So the Graston I would use in this area, and you know, the cup, you just push it down. Depending on you can either just let it sit for a couple of minutes and then change spots like this, and then change spots, or you can obviously also use it to glide. Now, because I don't have any cream, I can't actually glide on the muscle, but you know, just use the cup like this to glide. And the more you treat your shin muscle, it will get in a better condition, and you will have less and less issues and problems with the shin. Now, the last area where I want to show you is this area right here, where it's very common to have shin splint problems. So behind the shin bone, which runs along here, you will take your thumb and then you will push it inside. You will push it into the muscle, and then you will work your foot up and down 2 to 3 times, and then change and go a little bit further down. Now, right here, I found a problem area. So I will work the foot maybe 4 to 5 times, and then I will switch. And as you go down along the leg, you will find more pain and less pain. And then maybe when you are some 5 centimeters above the ankle, you will start doing circles instead. This is a very effective facial release technique, and you can do it as many times as you want. I will advise though, this can be very painful. Last but not least, if you take this part of your thumb, so you take the thumb inside and you grab here, you can really dig it in to this part of the calf, and then just go up and down to get a good massage effect as well, to complement the pressure points that I just showed you. So the pressure points together with the massage is super effective for releasing the fascia along the leg, and it will take pressure off the shin muscle as well. So releasing and relaxing the shin muscle together with the facial release along the shin bone is what's going to fix your shin. So that's it. With strengthening, massage and self-release, you should be able to fix your shins. The problem should go away, after a couple of weeks. You should definitely feel and see improvements. And in the future, you should have less occurring problems. When I had these kind of problems a few years ago, my shins were like, I had years of shin injuries. But when I started this strengthening, mainly the strengthening part, that's when my shin problems went away. And always when I get new shin problems, together with the massage, the self-release, but mainly the strengthening, I fix my shins once again. Because every now and then, especially now in the pre-season, I will get shin problems. So I hope that helped, guys. And if you need anything else, hit me down in the comments, and I see you at the next one.